Welcome to this unit on artificial intelligence and human rights. By the end of this unit, you will be able to discuss human rights issues in the use of AI in health, outline legal frameworks for AI and human rights. What are human rights? Human rights are standards for human behavior. They are a set of moral and legal requirements intended to protect the dignity and basic freedoms of all human beings. Human rights are listed in international conventions, which are designed to establish a baseline for the protection and promotion of human dignity worldwide. They are enforced through national legislation. International and regional human rights conventions are designed to ensure observance of human rights. International conventions include the Universal Declaration on Human Rights, the International Covenant on Economic, Social and Cultural Rights, the International Covenant on Civil and Political Rights. Regional human rights conventions include the African Charter on Human and People's Rights, the American Convention on Human Rights, the European Convention on Human Rights. Artificial intelligence and human rights. AI systems have the potential to both ensure respect for human rights and undermine core human rights standards. The Office of the High Commissioner for Human Rights has noted that AI and big data can improve the right to the protection of health when new technologies are designed in an accountable manner, offer improved access to healthcare. However, the office also noted that technologies could dehumanize care, undermine the autonomy and independence of older persons, pose significant risks to patient privacy. In September 2021, the High Commissioner flagged that urgent action is needed to address the risks of AI to privacy and human rights. In February 2021, in a speech to the Human Rights Council, the United Nations Secretary-General noted a number of concerns for human rights associated with the growing collection and use of data on the COVID-19 pandemic. He called on governments to place human rights at the center of regulatory frameworks and legislation on the development and use of digital technologies. Human rights organizations have interpreted and, where necessary, are adapting existing human rights laws and standards in the face of the challenges and opportunities associated with AI. For example, the UN has developed a roadmap for digital cooperation, with the goal of creating a safer, more equitable digital world. In 2020, the Council of Europe issued recommendations to its 47 member states on the impact of algorithmic systems on human rights. The Council of Europe is further examining the feasibility and potential elements of a legal framework for the development, design and application of digital technologies, according to its standards on human rights, democracy and the rule of law. AI and legal frameworks. Legal frameworks for human rights, bioethics and privacy are applicable to several aspects of AI for health. They include Article 8 of the European Convention on Human Rights, the right to respect for private and family life, home and correspondence. The Oviedo Convention on Human Rights and Biomedicine. The Convention for the Protection of Individuals with regard to automatic processing of personal data. The Council of Europe Guidelines on AI and Data Protection, Guidelines on the Protection of Individuals with regard to the processing of personal data in a world of big data, prepared by the Consultative Committee of Convention. Even with robust human rights standards, organizations and institutions need a better understanding of how human rights standards and safeguards relate and apply to AI. Governance, including new laws, is required to address the interaction of AI and human rights. The Ethical Charter of the Council of Europe's European Commission for Efficiency of Justice identifies 5 principles of possible relevance for AI used for health. 1. Principle of respect for fundamental rights. 2. Principle of non-discrimination. 3. Principle of quality and security. 4. Principle of transparency, impartiality and fairness. 5. Principle of under-user control. You have now completed Unit 1 of Module 2, Laws, Policies and Principles. In the next unit, we will look at AI and data protection laws.